Welcome everybody to the annual Cure JM Foundation's Medical Symposium. Many of you are old friends. Hopefully we'll have some new friends online. We think we've assembled quite an exciting range of speakers today that cover all the areas of interest for the Foundation. I'd just like to start by acknowledging if you're not presenting, could you put your microphones on mute, please? I'd just like to acknowledge some of the generous gifts we've had from various companies, including Catalyst, Optipharma, Biomed, and IV Solutions. I'd like to acknowledge Dr. Divergton and Duke for helping bring this symposium together. Just a little bit about the Foundation for those that are unaware of who we are and what we do. My name's Andrew Heaton. I'm the CSO of the Foundation, been with the Foundation for coming on 5 years now. There's been some significant changes to the way we diagnose and treat JM just in the 5 years I've been with the Foundation. Some of the breakthroughs that are coming through are really tremendous, and we're going to hear about some of those today. The Foundation's been going for some 20 years now. We've been involved in numerous clinical trials. We've funded a significant number of research studies looking at improving treatments, care, diagnosis. Our aim is always to try and decrease the diagnostic journey. We're making some breakthroughs in genetic studies. We also fund 4 centres of excellence, and I think importantly, we engage patients and families to actually help them get the best possible care. We have a clinical care network. The chair of our clinical care network is one of the presenters today. This provides a very high level of expertise in JDM, not only diagnosis, but also treatments and care. We offer fellowships and educational programs to help improve JDM knowledge amongst our clinicians in the wider medical community. We provide several important resources. These include past recordings of symposia, how to start a JDM clinic, resources that you might need for patients. They're all either available on our website or you can contact Laura, whose email is here. As many of you would be aware, what we do is we run several symposia a year. So in January and September, so we've already run a clinical care network educational symposium. We ran that earlier in the year. This is our medical symposium. We're going to run another clinical care symposia educational event in September, so stay watching for that. Next year, every 2 years now, we have our large national family conference. So it's in Chicago next year from June 26th to June 28th. So mark that date on your calendars. We have clinicians, researchers, our families and their patients are there, industry reps, and it's a fantastic event. We also combine a walk with the event. Research programs, I think one of the things that folks would be aware of is that we have an annual grant program that's currently open. Deadline is in August. We've funded a range of different people globally. This is not just open to the USA. I think some of the highlights is, you know, we funded some of our centres of excellence at Seattle, GW, UCSF, Duke for several years. We fund different biorepositories at Cara and Lurie. So if you're doing a JM research program and you're looking for samples, contact us and we can show you how to actually try and get access to those invaluable samples that have been acquired over the last, sometimes in the case of Lurie, for the last 20 to 30 years. We are international, even though we're a relatively small foundation that is primarily US-based. We always seek out the best possible research and the best possible initiatives for our JM research grants. So we've funded folks at University College London. And again, today we're fortunate to have somebody from the UK that stayed up late to present some of the work that has been happening at UCL, Bath, Utrecht. Again, we have somebody from Utrecht today that's going to present to us. I'd like to say that he stayed up late to present, but I actually think he's on a beach in the Bahamas. So that's probably why his video doesn't work. We also fund and are involved in leadership programs in different clinical trials. This has been done through GW, the NIH, and Binghamton. We've partnered significantly with NCATS, the National Centre for Translational Studies. So Dr. Travis Kinder was a very prominent fellow that we funded for several years who managed to screen every known drug through an assay system that he developed for an IFN-driven in vitro model of JM. So he did a fantastic effort doing that. The foundation's actively engaged in partnering with several institutions. So we were very fortunate 2 years ago to get a Chan Zuckerberg initiative on single cell programs. So that was very capably led by Dr. Jess Neely in California, Dr. Jessica Tournier in Michigan, and Dr. Jeff DeVergeston in Duke. So we're extremely proud to be associated with what they're doing. We also fund several mental health initiatives in our different rheumatology clinics. We're ably supported in the background and advised by an extremely capable medical advisory board, and I know some of them have joined us today. It's ably led by the chair, Dr. Lisa Ryder, and vice chair, Dr. Brian Feldman from Canada. And we like to think we've got a nice mix of not only some brilliant clinicians, but also some brilliant researchers and also some folks that have got an interest in the pharma and drug discovery program. So I'd like to acknowledge our MAB and all that they do to help the foundation and our various programs. A few housekeeping matters before we set off. If you're not presenting, please keep your microphones on mute. The questions, please put those in the chat box. The way that we're going to run the presentations is the presentations are going to go for around about 20 minutes. Lauren will be putting up a little alarm clock when the presenter's got 3 minutes of their presentation time left, just as an indicator to start wrapping the program up, so to give folks ample time from a Q&A perspective. I will read out the questions just to ensure that anybody that doesn't have access to the chat box knows what the question is before it's actually being asked. We are going to have in the chat box, Lauren's going to post a conference review, which is also going to have information on getting CME credits. So I know there was an issue with that last year, and we're trying to ensure that that happens seamlessly with our colleagues at Duke. So I think Lauren's email is on this slide as well. So once the little conference review link comes up in the chat box, you can go to that to not only review the conference and make suggestions as to who we should be getting to present next year, but it will also have information on the CME credits and some other useful feedback for us from a foundation perspective.